Fitbit service can also be found in most of the smart devices we use today. A Melbourne study has examined hundreds of days of Fitbit data from before and during the pandemic to show restrictions had a serious impact on the physical activity levels of working adults with type 2 diabetes. Study author Christian Breckenridge from the Baker Institute's Physical Activity Laboratory says this is particularly concerning given the important role physical activity plays in effectively managing the chronic condition. While many studies rely on self-reported data, this study provides definitive evidence of activity rates over 2,447 days. It also highlights how an accessible device like a Fitbit has the potential to support improvements in health, particularly in at-risk groups. Data was taken from study participants, desk workers aged years over several months in the lead-up to and during Melbourne's first lockdown in. Recorded steps reduced by an average of 1,500 per day and sedentary time increased by 51 minutes per day. Together, these behavioral changes over such a long period of time would be expected to have a negative impact on glycemic control and diabetes management. The results are published this week in the Open Access Journal. Diabetes align with other research observations that people who are overweight or obese are more likely to have their physical activity levels adversely affected by the pandemic. This is one of very few studies to track physical activity for hundreds of days per person. And the first to look at people with diabetes, the study found the biggest issue was the pandemic's impact on incidental exercise, as people were required to stay home and only leave for essential activities. The research team says potential contributing factors include minimizing movement to reduce the chance of community transmission, anxiety leaving the house, and a reduction in physically active commuting. It is important people return to pre-pandemic levels of incidental exercise to avoid the substantial negative health impact of excessive sedentary behavior, which is particularly exacerbated in people with type 2 diabetes. The good news is that even light and incidental breaks in sitting time, standing up, and taking a short walk are demonstrated to provide real health benefits, Christian says. Every little bit of physical activity helps, with recent research suggesting that just an extra steps per day can reduce the risk of developing diabetes. Maintaining good physical activity levels is also associated with a lower susceptibility to viral infections such as COVID's improved vaccine efficacy and reduced odds of hospitalization with severe COVID outcomes. This study demonstrates how devices like Fitbits could be used in clinical management in the future. Consumer-grade continuous measurement devices have already been used to prompt behavior change and improve glycemic control, and there may be added benefit by combining their use with continuous glucose monitors.